kyendaba mu kino kiri nti government tenabeera ne will, tenabeera n'ogwo omutima ogukomitinga kikyeteeka ku lupapula. Government ya Uganda severally yekomitinze to allocating 15% obutundu 15 ku kikumi ku sector ya health. Naye bwe tulaba what they allocate every other financial year, it is less than 5%. Less than 5% bakitegeeza nti and olaba nti eggwanga obulamu bw'Abannayuganda we buyimiridde. Gaps zonna eziriwo mu health sector ze mulaba and all the other sectors like the agriculture sector, the education sector is because government failinze kwekomitinga ku declarations ez'enjawulo zegenze ekola ki esayininga. Kati mu health yagamba ejja kukomitinga 15%. How many years down the road? 20 plus years. It has never even made at least half, not even a quarter of that budget. Mu agriculture yekomitinga, it will be committing 10%. Mu declarations za njawulo, Malabo, Bogenda East African Vision 2063, the African Union, all those declarations. Just recently, waliwo declaration yaliwo wane ye Kampala, the CADIP, Central African Agriculture, that program. Again, ye committing anti this government agenda committing 10%. What he has committed is only 3%. That is agriculture now, agriculture sector. Kati awonga kitegeeza government ya Uganda in terms of signing agreements with other countries, African countries, the Central, the Eastern and Southern African, those declarations. Koze bulungi nnyo. In terms of implementing those declarations, ezije ku lupapula, eziteke walking at the talk of those agreements. Kiremye ate kiganye. Kati ekyo kiri out of lack of political will to implement these declarations.
Leero tubadde nga tutunuulira ripooti ya kakiiko akatwala obulamu aka health, naye tugenza okulaba nti ng'oggyeko ssente government ze yabawa babeere nga bazikozesa mu mwaka ogujja, ebyetaavu ebivudde mu kakiiko biraga nti beetaaga ssente trillioni 1 ne milioni 600 nga zeeyongeddeko ku be baabawa. Kino kiraga nti obwetaavu bw'essente mu kitongole mu sekita ya health kiri waggulu nnyo, naye gavumenti ebadde etekayo ssente naye tezituukiriza emirimu gyagyo. Bwe mbadde njogerayo eri abannange mbagambye nti tutuuse kati okwekeneenya obutalaba just nti ssente zifulumiddwa. Twagala okulaba nti ssente ezafulumwa zikoze omulimo. Ekyokulabirako batugambye nti baagula ambulance, naye ate akakiiko katugambye nti ambulance ze baagula tezirikola kuba tebateekamu budget y'amafuta, tebateekamu obuwumbi 4 obwa mechanical maintenance. Ebitambula byonna byetaaga budget okulaba nti bweba emipiira givuddeko zyetaagibwa, service yetaagibwa, spare parts zetaagiza. Naye kyewunyisa nti government yagula ambulances 116 naye ne batateekayo bilioni 17 okulaba nti zino ambulance zikolebwa. Ne batoola ssente nnyingi nnyo ne bagula x-ray machines, naye x-ray machine wadde emu teteekabwangayo. Batulaga nti reports zaabwe ziraga nti bo baakola ogwabwe naye ate abalwadde tebafuna services. So neŋŋamba nti Minister of Finance alina okulaba nti oluusi essente obungi bw'essente tebujja kukola nga amaze otulaga nti waliwo omulamwa oba omuzungu kyayita outcome, nti zino ssente tuzisasude naye abasawo tubawadde emirimu ate we bakolera mu theatre okulongoosa abalwadde nayo weeri, naye ate eddagala naye lweri. Naye bonagamba nti consultant omusasudde milioni 15 naye theatre teriiwo. Consultant oba oli kumwonoonera bwonoonyizi ssente za gavumenti. Kati twetaaga budget ebeere ddala ng'etunuulira end service recipient omuntu wa bulijjo afunyeemu twafulumya sente okugula ambulance zitude oba ziri kukola okutwala abalwadde malwaliro in terms of referral system. So tetumanyi naye batu reporter bagisindise mu kakiiko ka budget okulaba nti ku sente ze basabye ezibulamu trillion emu n'ekitundu almost tulabe wetusobola okwogera ne Minister of Finance bakyusemu priorities zaabwe okulaba nti esente ezigenda mu kitongole kya Minister of Health zituukira ddala ku muntu wa wansi si kubeera awo nti ate zafulumwa zikoze ebintu bingi naye tewali service delivery ekirabirwako nti oba bayambye nti oba batweetinze abantu abalwadde.
We were invited, we raised momentum for the people. We went and told people that they are going to receive ambulances, but up to now, nothing's being mentioned. And we went to the Ministry of Health, by the way. Now, this goes back to the members of parliament where they think that some members from certain constituencies are not working hard because they have not delivered. Yet, we were all invited as members of parliament and they promised that each constituency is going to get an ambulance. Right, Honourable Speaker, when it comes to access to health, previously, we thought that it was distance from homes to access health centers. Now that government has put up infrastructure, the issue of staffing, like my sister has said. I want to thank the Minister, Honorable Nifakaweya, who came to open some of the health facilities in our area that were built by government. But most of them don't have staff and equipment. And we really wonder why does government spend money on infrastructure development without planning for other factors like equipment and staffing. I don't know when government will lift the ban, especially on employing health workers. We know that health is wealth. Right, Honourable Speaker, the issue of 2 billion for community health workers, I think 2 billion can be really considered to facilitate the community health workers so that they can continue doing the work. We know that funding has reduced with the Trump's orders, particularly with and other funders. But as government, I remember we had planned for the contingency fund that each year we should budget for the contingency fund to supplement these uncalled for, what can I call them? Disasters. Is it a disaster? It's not a disaster. Gaps. Budget gaps. Is that so?
Unforeseen.
Unforeseen. Thank you, Right Honourable Speaker. That's why you are so brilliant. For the unforeseen gaps. So, Right Honourable Speaker, on my phone I was showing it to my neighbor here that there is my constituency members who are sending me a message that the ARVs have reduced in places where they were getting them. They cannot access them. As a country, we had fought the battle.
Kasaja says colleagues' money will come. Okay, yes.
Drugs for our hospitals. Right Honourable Speaker, last week but one, I was in Masaka Regional Referral Hospital with a patient, but the situation I found there is so alarming. Patients are asked to buy drugs from private pharmacies, which is too costly to them. Right Honourable Speaker, Masaka Regional Referral Hospital is struggling with the drug stockouts due to high number of people getting services from this hospital. Right Honourable Speaker, we are in the budgeting process. Can we get a commitment from the Minister that in this coming financial year, all hospitals, especially Masaka Regional Referral Hospital will get enough drugs to save our people. Thank you, Right Honorable Speaker, for the opportunity.
Thank you. Honorable Zake.
Thank you, Right Honorable Speaker. Right Honorable Speaker, I'll begin from the same note. What everybody keeps talking about in our communities is about the lack of drugs in the hospitals. But my problem is about the issue in the statement that we've just had. There is always money budgeted to provide for drugs in these hospitals, generally, nationally. But in Mityana Hospital, I've never received any report. All the calls I get from my voters, they get to that hospital, nobody receives drugs that are for free. First and foremost, money is always solicited from all the patients, almost all patients. On a monthly basis, I actually spend more than 10 million to provide drug money to buy drugs.